Hi, my name is Kenneth Silva. I'm a CFSLP here at Speech for Success in the downtown Everett Clinic, primarily working with adult therapy. People, specifically adults, might see speech therapists for different reasons. Typically, when we think of speech therapists, we think of working with clients with voice or their ability to communicate. But you might be surprised to hear that speech therapists can also help clients with their memory and also their swallowing. Typically, clients are referred to us in the outpatient setting specifically by primary care providers who receive information from their clients on maybe changes that they've noticed, they've experienced. We also might receive a referral from a client who has experienced an acute event like a stroke, and they're just recovering to the point where they're heading back to either their house or an assisted living facility. There are actually a whole bunch of areas that speech therapists can help with. I mentioned a little bit earlier, but swallowing or dysphagia is something that we can work on with clients. Aphasia, that just means client has difficulty with expressing or expressing their own thoughts or ideas through speaking or writing or understanding others. We might also work with clients who have dysarthria, which just means generalized weakness in either their face or their body. Voice, obviously, stuttering, cognition, so things like memory, attention, other things like Parkinsonisms, and something that I want to highlight is helping clients who are transitioning to help them meet their ideal vocal identity. When it comes to vocal identity, I think of clients who are transitioning. So say they're transitioning from male to female, we can help provide them suggestions for vocal feminization. So some strategies, some therapy approaches that we might use to help them achieve their ideal quality of their voice, but also maybe the pitch or prosody, other things that go along with how we speak. I'll just give you an example. If a client were to be working on things like their voice, we might provide suggestions on how to minimize vocal misuse. I don't know if you've ever heard of the Lombard effect, but that just means that people who are in noisy environments tend to raise their voice because they're having difficulties with hearing what a person's saying because of their environment. So we might provide suggestions on how to communicate different ways to limit vocal tension or strain. We also might work on clients to help them with their memory, helping train them on external aids, especially if they don't know how to, say, use a Google Calendar or that they've never used a planner before. They've just remembered all their important dates. And then just something else that comes to mind is we might work with clients to teach them how to use speech generating devices. So if they've lost their ability to communicate with their speech, we definitely work with kids and adults. Mostly we see clients who have aphasia, expressive aphasia, and work with them to help them navigate learning a new speech system. And then education really is a big part of our job. So as speech therapists, we make sure that we not only help the clients understand the why to why we might be doing something, but also effectively, we're trying to effectively communicate how they might do it, the steps that are required to complete a task or a therapy approach. An initial assessment can vary depending on what the client's coming in for, but at the beginning, they might expect to have a conversation with the speech therapist to, one, figure out what's going on with the patient, but also determine any prior medical history that they might have relating to their concern or their challenge, and then also determining medications that might have an impact on their voice, because medications are actually something that not a lot of people think has an impact on the client, but there are medications that have their drawbacks or associated symptoms, things that they might cause. From there, we typically want to learn from them and figure out how their diagnoses or their problem is affecting them through either informally asking them or through a questionnaire to see how it's impacting either their quality of life or just how they do things in general. From there, we might complete standardized or non-standardized assessments to collect a kind of a baseline to help us figure out, one, if they need speech therapy, or help us figure out what we might be able to work on. And that just means what are their current strengths, and then also what are areas of concern. As I mentioned earlier, speech therapy looks a little differently depending on what the client's working on. Ultimately, however, we really want to focus on our goals, the goals that we set for our clients to be catered to their personal need for therapy. So after an assessment is completed, we go ahead and ask the client, what do you want to work on, or what do you want to improve in your life? And then we go ahead and try our best to cater the answer we've received from the client to the speech therapy tasks that we work on during our sessions. We as therapists want to try our best to help the clients meet their personal needs, but we also at the same time want them to recognize that ultimately the client's progress is up to them. So we really, for that reason, we also want to focus on client buy-in to make sure that they're willing and ready for change. One of my favorite things about speech therapy in general is just seeing a client come in from start to finish, seeing how they progress. Maybe at the beginning they might not be doing as well as they personally want to, but then as the end comes, we're able to discharge. We can see their progress. An example that comes to mind was actually just within this past year. I was able to assess a client, or I guess one of my supervisors and I were able to assess a client who was coming in for challenges with their memory after a pretty bad bicycle accident. We'd completed some intake information, and then we were off to the assessment, where we had to complete a pretty intense memory assessment. At the beginning, the client was pretty reluctant to even start the assessment because it was cognitively challenging. Fortunately, I was able to word the conversation or the explanation to the idea that we're collecting the baseline to figure out how we can best support the client to get them back to their daily life. After that conversation or explanation, they begrudgingly completed the assessment, but towards the end, they recognized how maybe they weren't doing as great as they previously thought with their memory, and because of that was kind of the spark plug to having them want to change for themselves. For several speech therapy sessions, we were able to work with them in addition to other people in our multidisciplinary team, like physical therapists and an occupational therapist, to help tailor their recovery to what they wanted. And I was able to see their ultimate discharge from that facility. So overall, it was just a really good experience to see how that specific client went through their personal recovery process, but also it helps me understand and recognize the importance of communicating the words that I use to communicate and help the client seek their personal change. If you or one of your family members is experiencing a change in their function to things like their voice, memory, or any of the other things that I'd mentioned earlier, I would recommend bringing up your concern to your primary care provider to determine if speech therapy is right for you. If it is, your provider might recommend an evaluation to see if speech therapy is right for you. If you're curious and you'd like to know a little bit more about what Speech for Success can offer you, don't hesitate to inquire with your doctor, or also reach out to our clinic. If you're curious and you'd like to know more about what Speech for Success can offer you, don't hesitate to reach out to your doctor or also our clinic. We offer both in-person and virtual sessions and can work with you to fit your personal scheduling needs. Thank you so much for watching. Feel free to like, comment, and subscribe. If you have any questions, post them down in the comment section below. Otherwise, check out the description for more information about Speech for Success.